right now. Aloha. This is so exciting. Hi, Sharon. Hi, Julie. Hi, Paula. Oh, there's Annabelle. Looking sharp, Annabelle. Hi, Jenny. Linda, I see your tile. Kim, Nigel, I see your tile. Claire, how are you? Well, there you are, Amanda. Yay, I haven't seen you yeah, I think.
Hi, I was joining off of transit for the other one, so I couldn't really do
Oh,
video or voice or anything. So nice to see you.
yeah, you as well. Well, thank you for engaging, even though you were on the move.
And Kiara's joining as well. We're both at clinic today.
Oh,
Hi, how are you?
good. How are you doing?
Good, nice to see you.
Good to see you too.
Yeah, right on. Oh, Nigel, we get to see you today. The mysterious Nigel. You were behind your black tile before. And are you in your clinic room today? No.
No, I'm at home today.
At home. Very good. Oh, Barb, there you are. Hi. I see you. Danielle, Marie. Okay, this is so exciting. Day 3. This is where we start doing some hands-on skills. Hi, Ashley. Nice to see you. No treadmill today. That was a really good idea. Yeah. So yesterday you got to hear a lot from me about what was going on with science. And today I want to hear more from you. And also, we're going to get our own hands-on experience with doing this work. Before we dive in, just do a quick land acknowledgement for the Sioux people of the South Okanagan, which is where I am streaming from. And I am ever so grateful to be able to live, work, and play in this beautiful part of the world. And I love setting the intention for a positive co-creative future where we work together for the health of the planet, for the health of each other, and that everybody gets the resources that they need. Hi, Sophie. I see you there. Hi, Connie.
Hi.
Okay, so let's hear from some of you. There's been some really beautiful shares in the Facebook group, and there's been some beautiful support for the people who have shared. And I just want to hear from some of you, what you've been picking up from what people have been putting into the group. So just pop your hand up on the screen so you can put your voice into the circle. Things that you have read about, things that you have observed that other people have gone through. What are things that you have that's moved you from in the Facebook group? Marie, I see that you were at work and you will be back. Oh, okay. I'm going to read her gem out. The digital model for the torso. Oh yeah, that's such a fun anatomy program. Also learn that surgeons are not on board for massage therapy pre-surgery or after. Some work for us to do. Some surgeons are on board. Not all surgeons are not on board. Some surgeons are really into it. Some surgeons are like, I'm afraid you're going to undo all my work and that you don't understand what the stages of healing are and what this person needs. So I don't want to risk it. So it's up to us to educate on, what we can do. So who wants to share about what they're reading about in the Facebook group? I know some people have really put some beautiful things up there. Anyone? Shy group. Okay. Well, today we have a really wonderful person joining us, Miss Annabelle. And I thought, you've heard a lot from me. It would be really good to hear from another therapist who is working with this population. So Annabelle is going to share her story about, getting into breast work. And without further ado, I will give her the floor.
Thank you, Erin. Good afternoon, everyone. First off, I'd just like to say who I am and where I work. So I'm Annabelle, and I work in Port Coquitlam, Lower Mainland. I don't know where everyone is. I started getting into breast work with Erin when she first set up the Mastectomy Guide, and first did her initial course in the Okanagan and asked me to come on board as a TA just to help her get things up and running and try it out for the first time, and it went really well. So that was really exciting. And yeah, she definitely piqued my interest in working with this demographic. I personally have had a lumpectomy, benign, thankfully. I'd had a little experience with my own surgery, even though it was quite minor compared to many people we meet. I work in a multidisciplinary clinic, and they've been really supportive with my breast work and letting people know that I do it. I have a breast specific day on Fridays, simply because as many of us are so booked ahead months in advance, it's really hard for people to get in and see you in a timely manner. So I decided to allocate my Friday shift to breast focus. But if I don't have enough people book for that day, I'll just change my settings and allow anyone else to book in if they want. They can come in any day they like, but I if they can find a spot. But it seems to be working out on my Fridays, and I had 4 people on the Friday just gone, which was really cool. My reason I'm part of the mentorship program. The reason I got involved was to become just way more competent and knowledgeable in every aspect of the breast treatment field. I have done some of the courses, but I feel I just don't have it really ingrained deeply, enough yet. And I want to be confident when someone asks me specific questions, or if I have to communicate with a surgeon or a GP, and also just to improve my communication skills. We were discussing yesterday about the importance of language around, a person who's going through trans top surgery versus someone who's had a mastectomy, but also just knowing how and when and what to say with each person, because they're all presenting in a very different physical and emotional way, I found. And it's really important that you say the right things at the right time, and don't put your foot in your mouth, basically. I've had a few challenges with this group of people, this demographic, scarring, hypertrophic and keloid scarring that I'm sure some of us have already seen in our practices. Knowing, can I do this? Can I make an actual change to this area? Hypertrophic, yeah, a little more easier to actually work with. Keloid, there's a risk you could make it worse. So I really am looking forward to learning the full scope of this I can't even think of the word, but journey of breast work, and just feeling really comfortable treating this demographic. So I'd started making some notes actually with some of my clients, and I said, hey, is there anything that you're not, you wish you knew before you had the surgeries? Did you feel rushed, or is there anything that was just bothering you more? And the big one was itchiness in the scars. And I just write down a few things here from some of them. They wish there was more information about the different options, for example, liposuction and the side effects after surgery, itching scars and lumps, they said. Everything was very rushed for some of them. They had to make decisions very quickly. And, you know, you're dealing with, especially if it's cancer, you're dealing with your life here. And there's a lot of very quick, oh, what do I do? Decisions to be made. One woman, she said she felt like a fraud because she'd only had a lumpectomy. So, well, what, you know, she was part of a breast cancer, I think it was a breast cancer group or something on social media. And she was like, why am I here? Because I just feel like I'm not a cancer survivor because I only had a lumpectomy. And she said, I just feel really weird compared to many of these people who'd gone through way more than I did. So, but I said, but your experience is valid, you know, that she's still not sure if she's fully clear either yet. So yeah, I thought that was quite interesting. And also just understanding for us, understanding the medications they're taking. Some take, I think, estrogen blockers. Lupron is a testosterone blocker. There's side effects to that. So just understanding those medications, I think, can be helpful. So we know, you know, okay, that's a side effect of that. And what else was there? Yeah, a lot of increased stress for them. I found the way I communicate, I think maybe it's come with experience as an RMT. I've been an RMT now for 12 years, and I'm a mature therapist. I went into the career late, so I feel my communication skills have improved generally over the years, and just knowing, yes, I think I'm pretty good knowing what to say and when not to say it. I think that's really important. Trying to think if there's anything else to add at this point. Anything else, Erin? Is there something I've missed? Any questions?
Yeah, let's take some questions from people because it's always interesting. Claire, I see your hand is up. Is that for questions for Annabelle?
Well, it could be for Annabelle or for you, or just a general share. Annabelle keeps mentioning language, and I just want to say how helpful knowing language. Oh, I didn't put my tooth in. Sorry, I'm missing a front tooth. I'm a neurodivergent community member, and I often have to put myself, I often play a role when I'm dialoguing with people, like, ooh, how would a normal person, and normals in quotations, but how would a not me person answer this? Or how would somebody who isn't me respond to this emotion that's being presented to me? Because my reaction, though I can express it in written form, isn't always, I just say, oh, okay, you know, like information just comes into me, and I don't respond the same way to people's stressors the way that they do. And so I never want people to think I haven't taken it seriously. So having an idea what the rest of you or some of the rest of you would respond is really helpful in any situation, but particularly when somebody's under a lot of stress. Yeah.
Annabelle, I think given your situation, that's probably something that you can speak to, and I can add to it as well.
Do you mean when someone is presenting with a particular level of stress, or they're anxious about something, do you feel, Claire, that are you saying that you're not sure how to come across and how to communicate back to them without them feeling that you're not listening or hearing them or care? Is that what you mean?
I think I'm pretty good at it at this point, because I'm almost 50 years old, and I've been me for a long time. But I had referred clients undergoing a lot of stress to another practitioner in town, And it hadn't occurred to me that that practitioner has a very flat affect on their face when they interact. And I know they're a caring practitioner. I know that they're a very knowledgeable practitioner, but the feedback that I'd got was they don't seem very engaged in, for me, I mean, I'm also French, so I'm like, woo, hands everywhere. And I'm pretty high energy, except when I'm in clinic, I'm very trying to modulate that, right? And be present for people. But I do question, having never interacted with me in a therapist role, I just interact with myself as me. I do question how, when I don't say much more than, oh, okay, when I'm given information about
What they're going through.
what they're going through,
I-
like, I don't know, do I go, oh, and how does that make you feel? Because
Yes,
you don't want to nudge if somebody's, or do they
you're,
want to talk? Do they not want to talk? Like, having not a script, because that's not tactile, but having an idea how other people
Yeah.
respond in
it's just,
situations is helpful.
I think it's just saying, for me, it's just saying that, yes, I hear you, I understand, and especially when they're feeling doubtful about their feelings, because, but your feelings are valid, and, I validate their feelings. I remember, perhaps some of you, I'm sure many of you know Paula Jasper, and she has said, you need to sort of just hold space and say, I understand. And sometimes I remember she's saying in school, remember, Erin, she repeat back what they said. And so it's in a way an affirmation that you've heard what they've said and what they're saying, you're hearing them, you're taking it on board, but it's not our feeling, it's theirs, but you're just hearing them. And you could make it, if it's notable, if it's chartable, obviously make notes about it. But it's just saying, I understand. I hear you. Or you could say, tell me more about that if you want to go down that route. It depends on how intuitive you are as a therapist. All of us, some of us are more than others, perhaps, and you sort of you just know the right things to say, and it comes across really well, and they really appreciate what you said. Some of us are more reserved and, okay, crap, what do I say now? This is really deep for me.
Yeah, and I think we have to be aware of our space as massage therapists as opposed to counselors. So saying, okay, is actually not a bad response at all, depending on what they're telling you about. Although if they're like, my husband just died and my child's in the hospital for chemo and I'm terrified about my surgery coming up, and you're like, okay, well, let's move on now. You might be like, well, she might be like, I don't think this therapist heard me. So it depends on, the intensity of what they're telling you. But if you're ever concerned, reflective language is very useful, because reflective language, then it shows that you've heard them, you've taken in what they've said, you're paraphrasing back to them, and then you can say, you can start it with, so what I'm hearing is, and then, X, Y, Z, and then you can say, is that right? And that gives them a chance to say, oh yeah, that's totally right. And then they'll continue on, or they'll be like, almost, but not quite. So do you want to try a little session with that and just do a little, like a little role play session just to try some reflective language?
I like the idea of actually, I just like that you've given me, so what I'm hearing is, like, that actually solves my problem right there. Because because that gives me, like you said, it's a reflective thing. It gives me a chance. I can easily integrate that in, but it seems more personable than me just going, oh, okay,
Yeah. And sometimes you don't need to dive, really deep into everything. And so then the, oh, okay, will be all right, because they're just, kind of giving you a list of what's going on, and you don't need to dive into every aspect. But when it feels appropriate to make sure that you your patient knows that you're picking up what they're laying down, then so what I'm hearing is just helps you enter into that reflective dialogue. Yeah.
Mhm.
Amazing. These are great questions. Thank you. Thank you
There's
so
some,
much.
there's some messages on the chat, Erin, if you want, if people are making some interesting comments.
Yeah. Okay, good. So Julie says, how do you start your dialogue approach someone when you're meeting them for the first time? So I'd say for that, I often say, so where am I jumping into your story? Fill me in on where you're at now. And then they'll be like, okay, so back in May, I was, first diagnosed, and then it took until June to get my first appointment. And they'll just kind of, so I'll give them that invitation of like, we're just going to have a little chin wag to begin with. So I get a sense of where you're at. So just let me know, where am I jumping into your journey? Just fill me in on where you've been and where you are right now. And then we can move forward together. Yeah, Nigel, even as a therapist, you can still be human. And that was something I was reading in the biopsychosocial spiritual model, which we covered a little bit yesterday, was in bringing the humanity back to medicine, we need to help the doctors be more human. They were talking about physicians in that article, but it applies to us as well. If we're more human and we show up as people talking to people, obviously we're professionals, but we're not behind this wall, then they feel like they can relate to you and they have that sense of, there's a person receiving me on the other side. So Annabelle, what would you say about that humanness in your treatments? And especially in relation to breast patients versus, standard RMT patients?
We have to, I know it's always challenging at times because we have to stay professional and non-biased and but I agree with Nigel. I'm a warm person, and I really care about my clients, and I know some people tell you their life stories. We get this, and people telling us a lot of personal deep stuff. I really try and sound like I really care, and that I'm listening to them and I hear them, but I also have to be mindful of staying within my scope and, maybe suggesting, do you have people to talk to about that? Is this something that you're able to cope with yourself, or do you feel you need some support? Something like that. It's tricky because we are exposed to a lot of some very, very hurtful things that they tell us sometimes. This is not just the breast patients. And
to
building
be able
trust.
to be able to keep the situation moving, because you are in a time limited time with them. You've only got a certain number of minutes with them, and if they're continually sharing, and you're like, well, our time on the table is reducing as the sharing is going on, then it is an art form to be able to help somebody get to the stage where they're ready to receive treatment now and hop onto the table. But you never want to rush that phase, especially with breasts, because sometimes people need to talk a lot before they actually get on the table. And it's part of that trust building factor where they're sharing. So they're like, I need you to know where I'm at. And B, it's a little bit of nervousness where it's like a bit of nervous chatter to kind of create a buffer between where they are and what they're going to be jumping into. And then sometimes it's a little bit of a delay tactic where they're like, I just need to know I'm safe with you. And in that conversation, it lets them know before they're actually on the table getting hands-on care. Yes, this is a safe situation. And now I'm ready to, bare myself to you so that you can lay your hands on my extremely vulnerable place. Yeah. And before we finish up here with Annabelle, I just want to say Annabelle was actually the one who introduced me to mastectomy work because she had a case study.
Yes.
And we were in the same class in school. And so that was my first introduction to mastectomy work, was Annabelle's patient. And then, you know, when we got into practice, I ended up taking the ball and running with it, but she was actually my first introduction to it, which is pretty cool.
Yeah, that was actually very complicated. So just FYI, everyone, I haven't had this in my practice yet, but this lady had only one unilateral mastectomy and had prosthesis and one prosthesis, but because her cancer was invaded her sternum, so she had her whole sternum removed, left her manubrium, and then she had mesh completely supporting her mediastinum, right, to support her costal ribs. And I was like, oh my gosh, like, so my treatment, it was just fascial work, but anyway, you know, but knowing, you know, really knowing and understanding, you know, what they've had done in their surgeries, and really, you know, and then it gives you an idea of actually what's safe and what's not to treat, you know. But that was really, really interesting with this woman, but I haven't had anyone like that since. That was extreme.
Starting off with a bang.
Yes.
So it looks like Linda has her hand up, and also Ashley has a question for you. So Linda, is your question for Annabelle, or is it just a general share?
It's okay. It was a couple of topics, so don't worry about it. Thank you.
Okay. Okay. Ashley, let's get you up here. Where are you? Just unmute yourself. Where are you?
Hi there.
Marielle, maybe you can spotlight her. There she is.
Hi there. Sorry, for some reason I can't see where the reaction's in, so that's why I haven't ever raised my hand.
Yeah, no worries.
But yeah, I'm just curious more. So Annabelle, you mentioned that you had taken the courses prior to the mentorship. Is that right?
Some of them.
Some of
Yeah.
them. Okay.
Yeah.
Okay.
I just sort of helped her out online with some of them. So there's, I think, the level 2, I don't think I got the full spiel, you know, so I'm looking forward to getting everything. Yeah.
Gotcha. Okay. Yeah. Because I was curious about like your, you know, obviously there's an immense amount of knowledge with these courses, and how obviously I understand the benefits of mentorship and things like that, but I'm wondering from your perspective, from working, has it been relatively like seamless to integrate all of those mentorship tips? Because I do a lot of coursework, and I think it's sometimes overwhelming. So sometimes I like to take, but I want to hear your perspective on that bridge between just taking the course and mentorship, and how that's been easy or difficult for your practice, if that makes sense.
Yeah, I mean, we're not fully into the mentorship program yet, you know.
Okay.
But, yeah, obviously I've been having some one-on-ones with Erin over the years, you know, and communication with her to support me. But I mean, from the courses, integrating into clinic has been pretty seamless actually for me. I found it really quite, I wouldn't say easy, but I'm really comfortable with it. Maybe it's just found my niche, but with the mentorship program, it's going to be a lot more in-depth, you know, conversation and, you know, and study. And I'm looking forward to that, because, you know, I know it's just the tip of the iceberg, as Erin has says, you know, with my knowledge, really. And I haven't had enough complex cases yet, you know, for example, lats, flap, or trans, you know, yeah, surgeries and things. So I also I've also promoted myself, so that's going to be helpful as well, as promoting yourself in your community. You know, actually people we've heard, you know, in previous Zoom discussions, that people struggle, like how to get the clients into your clinic. How do they find you? And I've advertised on, hopefully we can discuss more of that in the mentorship program as well, you know, but you know, I've advertised in just my local mom groups, you know, and my community page, just to start with. And I found one of my clients the other day, she actually said, I didn't even ask her, she actually said, you know, are you part of the Tri-City Mums group? I went, well, yeah. She said, well, they're actually, a lot of them are younger, but I'll happily advertise for you, she said.
Uh-huh.
So she'll totally promote me, you know. And I said, if you're okay sharing your personal experience, because you're obviously telling the whole group that you've had breast cancer, you know, hey, that would be great. So yeah, it can be scary once we've got this knowledge. Then now what do we do with it?
Yeah. Okay, thank you.
Yeah, thank you, Ashley. That's a great question. Sophie, I see that your hand is up. Have you got a question for Annabelle, or is it like a general share?
Question for Annabelle. I actually love the idea of taking 1 day, especially for the breast treatments. My question is, do you have new clients coming on Friday, or like it's a lot of following up appointments, right? So how you build it? If they come on Friday, let's say first time, when would be the next one?
To be honest, it's sometimes they can't come every Friday. So it's really, you know, as soon as they can. Yes, it's nice to have them follow up in a week. But sometimes some of them can't do that, or they're working around part-time work as well. Yeah, and you know, obviously now and again I'm off as well. I'm not there.
It's not so much about them, it's about you, how you, as far as I understand, you book the Friday off, especially to receive those people.
Mhm.
So do you keep a couple of slots off just to get them back, or how you do
No,
it?
so it's my settings. So in my Jane, we have Jane app. So I have call to book only. So people can't, the general public can't book in. So our front desk, they all know that I'll only accept breast patients on Fridays. So that's why it's call to book, no booking online, to weed out the non-breast people. And then Wednesday evening, maybe Thursday morning, usually Wednesday evening, I'll change my settings. If I've got remaining spots left over, I'd like to obviously be busy that day. So I will change my settings to allow booking online. And then I tell some of my clients, my general population clients, I'll tell them, if I haven't seen them very often, I'll say, hey, I'll give them the heads up about my Friday. Keep a lookout on my Fridays. No guarantee there will be spots, but so yeah, so it's easy for them to book in because the settings are set that way, and I have tags on my schedule to say only for breast, top surgery, so on, and that's it. Does that make sense? Did that answer your question?
Yes and no.
Somewhat. Yeah, I mean for me, I'm happy to do this. You know, it's just like seeing it's like having a follow-up with someone else, with a non-breast patient, right? So if they can come in the following week, great, they can book that day. Otherwise, I ask them to call up the clinic, you know. But sometimes it's not workable for them, and it's really hard for them to see me any other day because I'm just so busy. But they're welcome to if they can find a spot any other time. But yes, I do get a lot of new patients in. You know, most of my breast patients at the moment are subsequents.
Yeah. Okay, amazing. Some great wisdom there. Thank you so much for your question, Sophie. And thank you, Annabelle, for sharing your experience. Yeah, it's so helpful. And you know, what you're looking forward to in the mentorship program and the developments that you've been through as you've been going along. So I really appreciate you putting yourself forward. Thank you.
You're welcome.
Yeah. Okay, so before we jump into what we're going to learn, let's take a little quick stretch break. So just stand yourself up for a moment. And we're going to just switch gears a little bit. Give yourself a little bit of any kind of movement that feels good to you. I always find as I get older, my hips need more movement. They get stiff a lot faster. Okay, so let's dive into what we're going to be learning about today. I'm going to share my screen. So one of the things that we're going to go into is the science of mindfulness. I'm a big believer in mindfulness. I had a patient the other day, one of the few people who have, come in actually requesting, please squeeze me. I feel like I need squeezing, just so much depth. And I was like, well, I actually don't practice that way. And I went into why. And as I was doing the treatment with her, she was like, oh, this is so great. And she said, most therapists are not mindful. And my feeling is, if you're not going to be mindful, at least be firm. And I was contemplating that mindset of hers, which is, if you're not going to be very aware, you're not going to be very present, that firmness, it takes the place of the presence. It takes the place of knowing your person is fully engaged with you. And when you're fully engaged as a mindful therapist and you're giving yourself time to really engage with the tissues in a mindful way, you don't need the pressure. So this is some of the aspects of science of mindfulness. We're going to cover 4 areas of management and post-op breast care that are important to think about, and then get some hands-on practice with our own self-breast massage. And then I want to go into some of your one-year goals, because a part of the purpose of this workshop is to get you thinking about where you want your practice to be in 2024. How do you want to pivot to be able to support a new clientele in your practice? Are there things that you need to develop to be able to bring it in and have your goals be reached on the other end? So that's our major topic for today. Okay, let's talk about, first of all, the science of mindfulness. Now, mindfulness-based stress reduction, it is a 8-week program that's facilitated. And there's quite a bit of research on this style of mindfulness. It's one of the ones that has gotten more attention. And I think because it has a more procedural approach to it, it's easier for studies to measure. However, mindfulness is present in all sorts of different meditation traditions, yoga traditions, other types of spiritual traditions. And what we found is that it really helps the immune system function more effectively, which is really cool, because if somebody can be mindful, then they're helping to enhance their immune system functioning, especially an important component if they've been through a life-threatening illness. In particular, natural killer cells. Natural killer cells are, just pop in the chat if this makes sense to you, they're one of the first cells on the scene to help overcome cancer cells. They're like, this cell is mutating, it needs attention. The natural killer cells are going to be one of the first ones on the scene. So if that makes sense to you, helping to boost the immune system and natural killer cell activation, put a yes in the chat. Like, that's something that I would like to be able to help my patients to facilitate. Coping strategies. This is a really important one, because when you're going through things that are immense, you need to be able to cope. Mindfulness has shown it helps improve people's coping strategies. Part of that is stress management, where their sympathetic nervous system is coming down and they're like, okay, I'm carrying a more manageable level of stress in my body than what I had before. Helping to improve relaxation. Their own innate healing capacity inside their body triggers it so that their body's able to repair more effectively. And oops, where are we here? Oh, I thought there was something in here about the sympathetic nervous system, but I guess that's under the stress management and relaxation capacity, because it helps to reduce the sympathetic nervous system firing, which we have been learning that's a really important component for somebody to be able to heal. Now, this one I really love. This is showing how us as therapists, if we are in a mindful state, can help facilitate a more mindful state inside of our own therapists. Or like, if we're mindful inside of ourselves, that we can help trigger that mindful state inside of our patients. So the HeartMath Institute is a very progressive institute that's been doing research decades ahead of what the mainstream has to offer. And one of the studies that they did showed that when a therapist, or even just someone who's giving care, and they're doing it with this caring, healing intent from a very heart-centered place, when they're able to do skin-to-skin touch with the person who's receiving it, the heart's electromagnetic field of the giver, it can be measured with an ECG. And it's showing that when this giver is touching with this caring and healing intent, that the receiver's brain waves, they alter to become in coherence with what the electromagnetic resonance of the heart is showing in the giver. Does that make sense? Pop a yes in the chat if that makes sense. The person who is giving the treatment, if they are in this caring, healing intent, and they're doing skin to skin contact, then that actually shows it's changing the brain waves of the person who's receiving it to be in coherence with that caring and loving and mindful state. Does that make sense? So that shows if we are mindful as a therapist, that we're actually having this change, biochemical electromagnetic change in our patients' bodies, and that our waves, our electromagnetic waves are syncing up and becoming more coherent, and it's helping our patients come into that mindful state, which then triggers those innate healing mechanisms within our patient. So if that is something that you would like to cultivate in your practice, just pop a yes in the chat, and put one word as to why it's important for you. Like, what would be a result you think would happen if you're able to maintain that mindful state, like a consciously mindful state? What would you be, what would make that important for you? So just pop your answer in the chat there so we can get a sense. Connection, quality of life, better outcome for my patients, intuition. Yeah, all of those things are really important. Definitely better outcomes with our patients, because that's one of the things that we want is improved outcomes, right? We're all interested in patient care. That's why we're here. Exactly, Marie. Quality of care. The healing powers are going to expand. That's exactly right, Sophie. So this enables us to both be in our own state of mindfulness, which triggers that mindful state in our patients. And that's what's going into this biopsychosocial spiritual care. It's adding in that entire other level of both the patient and the therapist, right? Makes sense. We're a combined unit. We're both co-creating this experience together. And that's why what we bring to the table really matters. Okay, so now we're going to do a mindfulness practice. So I want you to get comfortable on whatever surface you are on. If you're sitting, then I want you to bring yourself into a comfortable place and close your eyes. I'm going to walk you through it. Those of you who are auditory learners, this is going to be easy for you. For those of you who are not auditory learners, I want you to just put extra focus on keeping in tune with my words. Now, take your right hand and put it up in front of you so that your thumb is facing you and your pinky is facing away. And then take the index finger of your left hand and bring it to the base of your pinky finger. Now, closing your eyes, breathing deeply. I want you to center yourself in the present moment. Become aware of your breath and become very still in the here and now. And then I want you to become aware of the connection between your index finger of your left hand and your hand, your ulnar border of your hand on your right. Become aware of the temperature between your two fingers. Become aware of the texture of the skin. You're not moving your finger around at this point. You're just tuning into what you're feeling. Try and resist the urge to move and instead become very aware of what you're feeling. Now, very slowly, move your index finger up towards the top of your pinky finger, breathing in as you lift your hand towards the tip of your pinky, and then rolling over the other side, breathing out as you're coming down between your pinky and your ring finger. And then breathe in as you lift your pinky up to the top of your ring finger, being very aware of what you're feeling, very aware of your breath, and then breathing out as you're coming down. So I'm going to turn my hand. You're breathing in, you're tracing your fingers and breathing in as your hand, breathing in as you come up on your finger, breathing down, breathing out as you come down on the other side. So tracing your fingers and being extremely aware of your breath, of the sensation that's under your hands, and of the experience that you're going through. Okay, so that's a little centering exercise. Now bring your palms together. And I want you to feel in your heart a very caring, loving intention for healing and well-being. And you're going to hold this intention that healing is possible. Okay, so you're radiating out from your heart this caring, loving intention that healing and regeneration is possible. And then I want you to consciously allow that energy to come down your arms and into your hands. And see if there's any change in the quality of the connection between your palms. As you're radiating this healing intent, allowing it to come down your hands and down your arms and out your hands, do you feel an added warmth between your palms? Is there an increased sense of tingling or energy or vitality? Has it changed in any way? And I want you to be feeling this feeling. Okay, so your hands become highlighted as truly instruments of healing, and that they are extensions of your heart, extensions of your intention, and that they are helping to transmit this intention through the palms, through the fingers. Now, keeping this healing intention going, I want you to lay your hands on either side of your face and just feel what it's like to absorb that healing intention through your hands, through your face, from your hands. And then very slowly, just start moving your hands around wherever you feel called. Moving around on your neck, on your head, on your body. And keeping a very slow, mindful approach. Your hands are soft. Your intention is to allow this care from your heart, your belief in your ability to regenerate, to be picked up by your body. Okay, now just pop in the chat a word that will describe what it's like to receive this kind of touch. What does it feel like when hands with healing intention are laid mindfully on your body? Pop a word in the chat. Julie says calming. What does it feel like to you to be receiving touch like this? Pop your word in the chat. Warm, nurturing, confident, nourishing, comforting, grounding. These are all great words. Okay, safe, wonderful. Feels like a light going through. Okay, now we're going to do the opposite. So shake your hands out. Shake, 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 shake. Get rid of all that mindful touch. I want you to think about somebody who cut you off in traffic over this last week. I want you to think about what you had for breakfast and the fact that you're actually getting ready for dinner, I want you to think about anything other than treating, anything other than, you know, mindfulness. Just put your mind somewhere else. It's especially good if you're ruminating about a problem that your life is having. And then I want you to put your hands together. And first of all, actually, no, skip that. Okay. Thinking about all the different things, and then just start putting your hands on your body like you're doing a treatment, but really you're kind of on automatic pilot. Just put your hands anywhere. You know, this is you at work. You're aware your hands are on the body, but really you've got another part of your mind thinking about something else, whatever it is, anything else. Okay, now shake out your hands and put a few words in the chat. What's the quality difference between a mindful touch and an unmindful touch? What does it feel like? How is it different? Scattered, aggressive, cold, clinical, rushed, superficial. Okay, these are all great descriptors. Now, if you're a patient and you are showing up, you've been through something potentially traumatic, you're bearing a sensitive part of your body, and you have a non-mindful therapist, are you going to feel safe receiving that treatment? Is this something that you would want to go back to that therapist to get treatment from? If you are triggering somebody's trauma and you're a non-mindful therapist, it's not going to create a great, you know, trusting long-term relationship. So just take a moment in your book to write down a couple of those words so that you have it clear in your mind. Harder and heavier. That's also good. Dull. Those are really good descriptive words here. Yeah, thank you. Julie says, good point in exercise to feel the difference. It's really important, especially for us to have our own personal experience of what it's like. Okay. Yeah. Julie says, when we're scattered or unsettled, it is felt by others. It really, really is. And sometimes they'll notice it consciously, but sometimes they only notice it subconsciously. And they just don't really feel like they can settle in and receive the treatment very effectively when their therapist is only partially there, you know, scattered, thinking about different things, hands are running. I mean, it's not like you're not aware that your hands are on a person. They're just not really aware, and they're not really transmitting that healing intent. So one of the prime areas that we can make a positive effect in as massage therapists, especially in terms of what research is available, is stress management. And stress management is so important because when somebody is feeling super stressed, then their hormones are going off, their sympathetic nervous system is going off. And Swedish massage has been shown that it decreases the stress hormones. So this is something that you can, you know, biochemically affect in your body, in your patient's physiology. And if they've been through trauma, then they need to know, you know, they can come down off the ledge and be into a much more receptive, parasympathetic healing state. Stress hormones do all sorts to your body. They change how your body functions. They change your ability to cope, your ability to process information. Like there's so many different levels. And Swedish is one of our most basic techniques. So you don't want to overlook the little guy. In some places in the world, that's all massage therapists do. In Canada, we often have a larger skill set than that, and some RMTs kind of overlook Swedish. They're like, oh, it's too basic. I don't want to do it anymore. But for this population, it's highly appropriate. And also, it triggers that feel-good response in somebody's body where they remember, oh yeah, it actually feels good to be in my body. I forgot what it was like to feel pleasure in my body because my whole experience has been being cut, you know, needles going in, being radiated, being poisoned, and they just need to remember, oh, I actually do enjoy being in my body, and this may be one of the doorways that helps open up that pleasure response again. Another area that we want to manage is pain. Now, this is helping clarify, I mean, it's only one aspect of light touch techniques, but when you're working on the mechanoreceptors, they live in the tendons of the muscles and they respond to very light touch. They don't need a hammer. So you can have a great effect on the tone of the muscle belly, on how the muscle is firing and functioning and transmitting pain signals by working with the mechanoreceptors in the tendons. You know, when you're activating the mechanoreceptors go to the central nervous system, the central nervous system then sends the signals down to the peripheral nervous system. And so you can moderate the amount of pain signals that are going through and the amount of tone that's in a muscle without actually reefing on the muscle belly itself, which also saves your hands in the process. It's way more bang for your buck. It's like working smarter, not harder. Another area is myofascial massage. Now, this one has been shown to be useful for restoring upper limb mobility following breast cancer surgery. It's something I use a ton in my treatments. It's probably one of my go-tos. And, you know, if you can help that slide and glide between the layers of tissue, then you're going to help the body to be able to get an increased range of motion because it's not full of adherence. Now, for those of you who were here live yesterday, or maybe you caught the replay, then, you know, you got a sense when the body is opened up during surgery, they're pulling a lot of areas away from the body. They're retracting the skin, they're opening it up, they dry it out. And when they put it back together again, all those layers become adhered. So if you're doing myofascial work and you're creating fluid between the layers of tissue, you can help it overcome that adherence and be able to slide and glide more effectively between the layers of tissue. Just pop a yes in the chat if that makes sense. Creating slide and glide helps restore mobility. Yeah. Okay, great. Now, a fourth area, of course, is scar tissue management. There's no way you can do this work without being in scar tissue management. So one of the things you want to think about is reducing the amount of tissue tension helps reduce the amount of collagen that's being deposited down, which creates a smaller and more pliable scar. Now, volume of collagen is not the only thing that goes into the quality of a scar, but if your body is laying down more and more and more collagen because there's so much tension on the tissues, it's like, oh, we need to make a massive bridge to hold these two sides together because they're so full of tension. Our bridge has to be equally as strong. And so then it's continually getting signals to lay down more collagen, more reinforcement needed, you know, big divide here, need to bring these two sides together. However, if you have a much less tissue tension between the two sides, then the body's like, okay, you know, we do need to repair this, but we don't need this massive bridge. We can just do with, you know, a footbridge instead of the Lions Gate Bridge or the Golden Gate Bridge. If you're American, you know, it doesn't need to lay down as much. So if we can help with tissue tension, then we can help the body lay down a much more reasonable size scar that is more pliable and is not prone to holding so much. So put a word in the chat. What does this make you think of for your own treatment? What's a word that this triggers for your own treatment? How can this inform your treatment? What's a word that describes it? Reducing the amount of tissue tension to create a smaller scar. What would you say? There's no wrong answer, just your gut answer. Yeah. Everyone's thinking. More movement equals less restrictions. Yeah, Renata, slowing down. This is a really important one because, you know, when you're not a very mindful therapist, you might actually be moving really fast. And when you're moving really fast, the body doesn't have a chance to respond. So if you can substitute time for pressure, you're actually giving the body a chance to respond, and you can have more lasting effects without, you know, forcing or causing any kind of rupture in the body. Yeah. Confident change, less embarrassment for clients. That's interesting. Embarrassment. What do you mean by embarrassment there, Claire? That's an interesting, interesting word.
Well, I'm just thinking myself, I have scars on my back, and I know when they were first, when I first had them, happened to be the year I had to wear a prom dress, and I was horribly embarrassed by their sticky outiness, their bright readiness, their everything.
Their appearance was hard. Yeah.
Yeah.
That's really a thing. Thank you for that. That's because when people have, you know, scars, sometimes they really feel uncomfortable about sharing them. So lots of people after having a mastectomy, they're like, well, I can never wear a tank top or a bathing suit again. My summer clothing is out the window. I have to now wear, you know, fully covering garments because I don't want to be showing my scars. So if we can help reduce the volume of scar tissue that's going down and help the appearance return to something more discreet more quickly, then we're creating a good quality of life service for our patients. So let's move into some treatments. Now, this is where you're going to need, there's two things that we want to focus on. One, we have a video for you so that you're able to practice alongside the video. It's just basic Swedish, but it's for the breast area. And you're going to be practicing on yourself, only one side of your body, not both sides. And you're going to be doing it with your camera off. So this is not something that we're going to be watching each other do. So you're going to have your own privacy behind your black tile. And you're going to be doing it alongside a video. This is from the Mastectomy Guide treatment library. And it's about 7 minutes long or so, 7 to 8 minutes. So there's two things that you're going to do. One of them, it shows in there about draping. So that's kind of just a little bonus for yourself. But you're going to do two things. One of them is the Swedish, and the other is the GTO release for your pec major sternal attachment. So we're going to do that first. So whichever side you're going to be working on, I want you to practice this right now, and then you're going to be doing it in your treatment. So you're just going to be doing with your fingertips. This is not a whole hand thing. Your fingers are soft. You're not doing a very intense movement. And you're going to be doing little hashtags. So you're going to go down, over close right now. You're going to be going down, up, over, over. So you're going down, up, over, over. So it's like you're making a hashtag symbol, and you're going to be going from your suprasternal notch down towards your fifth rib. Okay, down, two short strokes down, 2 short strokes up, 2 short strokes over, and then 2 short strokes to the other side, and then come down. And you're going to be doing the same little hashtag. Yeah, just at the edge of the pec major border on your sternum. So you're creating these little opportunities for the mechanoreceptors in your pec major tendon to respond to this light touch, just letting go, letting go. And once you've gone all the way down, you can move to your clavicle and then doing the attachment on the clavicular head Same movements. Too many down, too many up, too many to one side, too many to the other side. So those are the only two parts of pec major that we're going to focus on for this exercise. And even so, just with that, I want you to tune in and now feel the difference between the side that you've worked on and the side that you haven't. And pop a word in the chat about the difference between the two sides. I mean, for me, it feels like my right shoulder has dropped. It's not being held as high. I feel like I've got a sense of movement, and I actually feel like I can breathe more easily on this side. Ashley says it feels more open. So even that mini exercise, I feel a difference. Jen says improved rib expansion. Yeah. Nigel says decreased tension in the shoulder. Kim says fluid versus sticky. Okay, so that's not a heavy treatment. You're not burning out your hand by any stretch. You're not manipulating the entire pec major muscle, but just those little things, you've already had an effect. So this is why we're going to only do one side of the body, so that after the experiment, you'll be able to differentiate between one side and the other. Okay, so I'm going to give you a minute to get yourself in a private spot where you can do your own self breast massage. And then I want you to have a piece of fabric that you can use as your own drape. So you're going to put on the side that you're going to be working on, say you're going to do right breast massage. You're going to be putting the sheet over your left shoulder and under your right hip. And you're going to see it in the video. And it's going to give you a little bit of a demonstration. Okay, so everybody's tile, your camera's going to be off for this. And then we're going to come back on once we're done the exercise. And you're going to be unclothed for this. So you need some kind of lotion or oil that you're going to be able to do your own Swedish massage with. And then when everybody's ready, just pop a ready in the chat. Type the word R or ready if you want to do the whole word. And we're going to all start together and do our own self Swedish massage on our whichever side you want to work on. Doesn't really matter. Okay, got some people who are ready. Awesome. Those of you who still have your camera on, pop your camera off and get yourself in the position that you are ready to start. You want to be able to see your screen though, because I'm going to be playing a video. Now, a note on this video. This was my first time filming, so I was a little nervous. So my hands are faster than I would normally do in a treatment. So just be aware as you're observing, as you're following this along, the pace is a little faster than I would normally teach, but you just have to start building your resources where you're at the time. And if you wait for yourself to be perfect, you'll never get anything done. So caveat, normally we'd want these hand movements to be a little bit slower. Okay, I'm going to start the video. So we're going to undrape. In this lesson, we're focusing on the circulatory techniques. So first, just tuck the sheet under the shoulder, ulnar border to the sternum, get permission to undrape. Is it okay to undrape? Okay, so then fold the sheet down, and then I've got the whole sternum to the ribs exposed. So we're focusing here on helping increase the venous flow, arterial flow, promoting the revascularization of the area. And if your patient has a side that has not been surgicalized, it's just as nature gave them, then you can be doing healthy breast massage on the side that they are unaffected on, okay? So we're just starting with some nice gentle sweeping, warming the area up over the shoulder and the neck, down the arm, going over the breast. So we start first on the breast, the ribs, the side of the body, before actually going in and working on the globe of the breast. Okay. Now, when you're starting to do some scooping, you're going to do this pincer grasp, and you want to just come from opposite sides of the breast. So you're down below or up above, or you're medial and lateral, and just starting to move the breast tissue around. The pressure is not that deep right now. I'm just focusing on increasing the circulation, creating an open channel through the blood vessels, warming the area up, and enjoying the freedom of not working around sheets or chest drapes or anything like that. Okay, now I'm gonna do, starting on my little bit of deeper work around the clavicle, some fingertip kneading, feeling in through this divot in the lateral chest where the pec minor comes through, starting to think about improving the vascularization of the area. And go the lateral border of pec major. Work your way down to the obliques. And around to serratus. Just doing a little bit of deeper kneading. Aware that on the side body here can be super tender for people. Now, if somebody has really large pendulous breasts, they might be hanging down all the way over here, in which case you would just come down from the lateral side, scoop up, and then hold the breast tissue more medially, and then work your way here along the side of the body, holding the rest of that breast tissue out of the way. Okay, now some areas that are important to think about clearing: this inframammary fold region here. This area here can get very clogged and tender. The lymph nodes that come down through here, they often just aren't able to drain very effectively. So helping this area, as long as they don't have lymph nodes removed, or maybe just one or two in the axillary region, you can help it to drain out the side of the breast and then up towards the axilla. Okay. When people wear underwires a lot, this area can get super, super tender, and often they can't take very much pressure here. So you just want to think about the direction of the lymphatic flow and just help the breast drain. This is not really lymph drainage per se, but you're just thinking about the direction that the lymph drains and then working with it in your circulatory techniques here. Okay, you can go from the nipple medial, so starting to do some drainage this way. And helping the fluid to move up towards the clavicle here. Okay, so you're just thinking about opening the channels of the breast. They spend so much time pinned into bras and tight clothing and they don't really get a chance to move and shake the way that nature intended. So the fluids can get really stagnant in there. So you want to help move the fluid and just clear the area so that it can be nice and refreshed. Okay. Now, if you want to do some picking up, you're going to be making an L shape with your hands and then actually going on either side of the breast and literally like picking it up and then scooping away. Okay, picking up, scooping away, picking up. So you're creating some space. Theoretically, it's not literal, but you're sort of decompressing the retromammary space along the chest wall and thinking about creating a vacuum that the fluid can rush into and flush clear. Okay, you can also go from superior and inferior, picking up and then sweeping away. Picking up, sweeping away. Good. Okay, a really nice way to sweep around the globe of the breast is, I'm going to leave you hanging there. So now I want you to go into your GTO release on that side. So the same side that you were doing the Swedish on, and then do your GTO release along your pec major, sternal border, and clavicular border. So I'm going to give you a couple of minutes to make your way through that. Working your way down the sternum, along the clavicle, thinking about the mechanoreceptors and the tendons. And then moving back to your circulatory work, thinking about the venous flow, which goes out towards the sternum and the axillary area and the clavicle, versus the arterial flow, which comes down from the same areas towards the nipple. So you want to be feeding the breast after you have done your clearing work. So as we're getting into this part now, you want to think about helping to bring healthy, fresh arterial flow to the breast. So you want more of your strokes to be going from the clavicle, the axillary area, the sternal area towards the nipple and areolar complex. When you're working with a patient, you cannot touch their areola or their nipple. On yourself, it doesn't matter. For a patient, it's a no-fly zone, but you want to be thinking now about bringing healthy, fresh blood flow into the breast so that it's being nourished with that freshly oxygenated blood, which comes really close off the heart and down in to feed and nourish the breast. Okay, and then just a few finishing strokes, very light effleurage, just signaling to your body that you are moving away from treatment. You're bringing it to a close. And then popping your shirt back on, your garment, whatever you were wearing, giving your hands a wipe down, and when you're ready, popping your camera back on. Awesome.
Yeah, I can't turn my camera back on because you guys have stopped it.
Have we?
Yeah.
I can give a request there.
Here we go.
Okay,
It's
amazing.
now.
So, good. For those of you who are back, just pop some words in the chat about what the side that you worked on versus the side that you didn't work on. What's the difference? How do you feel? Or pop up your hand and put your voice into the circle. Annabelle says open. Kim says cloud, airy, and light versus heavy. Great descriptors. Claire says more alive, including my scapula. Amazing. Lighter. Feels good. Looser. Yeah. And that's only a few minutes of massage. It's not anything super in depth, and it's not anything super complicated, but it's had a very positive effect. Ashley says her neck feels better. Julie, I see your hand is up. Let's hear from you.
I picked the wrong shoulder. I should have done the other one.
Yeah.
But I just have a question. I know we're not the nipple area isn't supposed to be touched, but when you're doing stuff, you're still kind of near it or going over it a little bit. So how do you treat to really not touch it at all?
There's different
Does that make
ways.
sense?
Yeah, there's different ways of tenting your hand so that you can work up to the borders of it, but not on it. And we'll go over that when we're inside the program, but there are strategies
Okay.
to be able to avoid it. Yeah.
Okay.
Claire, your hand is up.
I don't know, you might talk about this in the program, but in that scooping motion, I mean, back in 2000 when we did breast massage, we used a technique we called fluffing, which always sounded a bit pornographic, but where we would do the scooping, but with a shake, a pickup,
Like
and
a gentle
and a-
jostling kind of.
yeah, like a ooh, and it's very effective to get stuff going. Very popular back when I used to do a lot of breast work
Back in the day. Right on.
back in the day.
Yeah. Okay, thank you. Sophie, let's hear from you.
I find that side of the body, the serratus anterior area and obliques are very sensitive for my patients and even for myself. So even how I would word it, when it's too light, it becomes ticklish. When it's coming from too light to a little bit heavier, it's already painful. So
How do you handle that?
yeah.
You need usually more of a soft compression as opposed to movement, because when the nerves are very sensitized, then movement can activate them. So you want to, instead of that moving motion with your hand, you want more of just a soft, gentle compression, and then release and compress again, and have more of an approach like that until the nerves start to settle down, and then it's able to take more movement on them. Does that make sense?
Yep. Thanks.
Yeah, you're welcome. Okay, Paula, let's hear from you. It's probably our last share and then we can move on to our other things. So let's hear from you.
Ticklishness in general, and in this case, I find having somebody bring their hands very close by helps. So first they could push your hands out of the way, but also it gives a broader sense of feedback. It's not so focused.
Very good tip. Thank you. That's great. Okay, cool. So now we've been able to see there's ways that we can work with this part of the body that are very simple. They're light touch, but they really have an effect on a lot of different aspects of what somebody's experience is like. So since we are nearing the end, we're in our last few minutes here, I want to bring up, if you are interested in learning more, the Mentorship and Training Academy is your route. There's no other program like it. I'm super confident. This is very unique and it has really everything you need. It's like a one-stop shop under the umbrella to be able to answer your needs to pivot your practice. So if you haven't already booked your clarity call, I know some of you have, and I'm going to be speaking with you later. For those of you, if you're interested, Marielle's going to drop the link in the chat so that you're able to book your clarity call, because this way we can talk more about your goals, which we're going to get into in a moment, and, you know, craft a little plan for you for your year ahead so that you can shift your 2024 practice to the direction that you want to go if you're feeling called to support this population. And like we've mentioned already, this is a really needed area. We need more therapists who are comfortable with it. Patients need it for their own care, and you as a therapist, you may need it for your own longevity. Like, you may be a seasoned therapist and you still want to be of use, you still want to be contributing, but your body is getting tired and you're feeling like, I need to reinvent myself a little bit so that I'm able to continue offering treatments. I don't actually want to stop massaging. I just want to change it a little bit. Or maybe you're a newer therapist and you're feeling like, I just want to start out in the way that I want to go. I want to be able to direct my practice right from the beginning. And you may feel called because of your own, you know, personal experience with breast cancer, or somebody that you know that you wish you could have helped, but at the time you didn't have those skills. So this is an opportunity that's in front of you. I feel really strong about the program. I know it's a good program. It's really comprehensive. There's nothing like it on the planet. And you get both business skills and technical skills blended together to help you develop your practice in the direction that you want. And I hope over these 3 days, you've had a sense of what it's like to learn the methods that we teach through the Mastectomy Guide programs, and the sense of community that you get when you're with people who are caring, that they want to improve the world around them, and they want to, you know, be contributing to moving the needle forward. So is there anyone who has questions about the clarity call, whether it's right for you or not? Some of you I've had calls with already. Some of you have already got them booked. Is there anyone who has any questions about the clarity call that I can answer for you? It's 30 minutes and it's an opportunity for you to have a one-on-one session with me and get clear on what your year plan is for yourself, so you can start pivoting and supporting this population in your practice. Okay, so I'm going to leave the 1 year goal exercise, which is in your book, for you to do on your own, because I want to honor everybody's time. But we also have an activity for you to do in the Facebook group, and we're going to be announcing the winners tomorrow at noon. So you're going to want to make sure that you put your share in the group. And what your share is today is about your experience of mindful massage and how this can inform your treatments. Okay, so I'm just going to share this screen here. This is going to go up into the Facebook group. your experience of mindful self-massage to your breast and chest area and how this can inform your treatments going forward. Okay. So we are, oh, and also remember to like and comment on 3 other people's posts. So everybody gets the opportunity to feel seen and heard and validated. Okay, so this has been a really amazing 3 days. This is the end of our workshop, the end of our time together. I really want to say thank you so much. I really have enjoyed it. It's been really interesting for me. I've learned a lot. And I really hope that you reach out and book your call, because that's your avenue in to get into the Mentorship and Training Academy. And I really want you to be a part of it. So if you feel called, if you feel like it's the right thing for you, then please book your session, because this is the way in. And I don't want you to get left behind if you're feeling like this is for me. If you have questions and you're like, I'm not totally sure, but I want to, you know, explore a little more, book your call. This is the way to get in. Okay. Yes, you're welcome, Nigel. Lots to think over as well. Claire, thank you. Kelly, thank you. Hopefully I will see you. I will see you soon. Okay, we'll be announcing the winners tomorrow. Ah, Annabelle, so sweet. Yes, Sharon, thank you. And thank you for your shares, especially on the first day when everybody's getting to know each other, and you were very brave and shared about your experience, which I know was really valuable for a lot of people. Yeah. You are so welcome. All right, book your call. Hopefully I'll see you there, and make your posts in the Facebook group. Okay. Ciao for now, everybody.